Hey guys, Laura Haley, nurse practitioner Medonc. Just a quick overview of health promotion in cancer care. So we look at an introduction, role of the nurses, key strategies, the impact, and a little bit of a summary. That's a bit blurry, sorry. Health promotion, as we know in cancer care, is a process that actually enables patients to increase the control over and improve their health. And quality of life during and after the cancer treatment. So we kind of focus on their lifestyle changes, early detection, and ongoing support, which can actually lead to better health outcomes and improved well-being for individuals with cancer. Our aim is to reach a state of complete physical, mental, and social well-being for an individual or a group. We must be able to identify and realise their aspirations, satisfy their needs, and enable them to cope or change with the environment or the trajectory or the new diagnosis. So we actually see health as a resource for everyday life, not the objective of living. It's a positive concept in emphasising social and personal resources as well as physical capabilities. Health promotion is not just the responsibility of the healthcare sector, but it goes beyond that to healthy lifestyles, to well-being for individuals. It actually health promotion helps to reduce the burden of cancer by aiming to prevent it in the first place, if we can, manage its effects and improve quality of life for those that are actually affected. So as we know, with the rising cancer survival rate, which is amazing, promoting health is crucial to reduce recurrence risk, manage the comorbidities and improve their well-being. So the World Health Organization actually puts prerequisites for help, so the fundamental conditions and resources for health as peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice and equity, and improvement in health requires a secure foundation in these basic prerequisites, which we hope to supply for all. So, role of the nurses, we are caregivers, we're educators, we do health promotion daily. We also look at symptom awareness, not only educating the patient but by reviewing them individually. So when we're assessing them, that we do continually. We also advise them on screening. We're advocates for lifestyle modifications that may actually improve the symptoms or the risks or actually any other issues that's going on. We also provide psychosocial support and counselling on healthy behaviours. We coordinate multidisciplinary care and follow-up. So we play a crucial role in the care and support of individuals with cancer. We also have unique opportunities to influence and promote positive health behaviours. We have regular interactions with patients, so it actually places us in that unique position to help provide tailored and evidence-based recommendation. We can facilitate referrals to appropriate programmes or specialists, and we can be there as that support and advocate for the patient as well. So, health promotion strategies, so lifestyle modifications, so physical activities, so Clinical Oncology Society of Australia recommends physical activity, so they recommend regular exercise, so a moderate intensity, 150 minutes or 75 minutes of vigorous intensity, which is aerobic activities, walking, jogging, cycling, or swimming. So they say that should be, that is 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activities per week, and 2 to 3 resistance exercise sessions per week, such as the TheraBands in the image, Pilates, lifting weights, to actually engage those major muscle groups. So previously, I think the advice to patients would have been to rest during treatment, but now we're realising and understanding with more evidence that exercise actually helps that circulation, helps manage fatigue, helps manage appetite, speeds up recovery, strengthens muscles and bones, as mentioned, improves circulation, helps to reduce the risk of recurrence in some cancer types, and actually helps patients reduce the risk of developing other health problems, improves quality of life by reducing stress and improving mood. And COSA, so the Clinical Oncology Society of Australia, their position statement in 2020, which advocated for the exercise, is that exercise should be prescribed to all cancer patients as a standard part of their cancer care to help manage the effects of cancer and its treatments. So that's quite interesting. So again, lifestyle modifications, diet and nutrition. So we advocate for healthy nutrition, so promoting healthy nutrition to support immune function, cell recovery, and reduce the risk of cancer. So the World Health Organization classifies processed meats such as bacon, ham and salami as the highest group with a risk of cancer. So they're a group 1 carcinogen, and they have a definite link with cancer, and they're in the same category as tobacco, alcohol and ultraviolet radiation, so UV. So red meat is grouped to 2A carcinogen, so not as strong evidence as the group 1, but it still can increase the risk, so that's red meat. So they actually advise that you eat little, if any, processed meat such as bacon, ham and salami, and to aim for no more than 455 grams of cooked lean red meat. So that's beef, lamb, pork, kangaroo, goat per week. And that can be 1 serve a day or 2 small serves at least 3 to 4 times a week. So they do advise on swapping red meat for fish, chicken and eggs or legumes, like chickpeas, lentils and such, and get adequate amounts of the nutrients that you need. They also suggest 8 to 10 glasses of fluids per day, so they actually say water, but fluids is taken. As I mentioned about the cooked meat, so no more than that 455 grams. And Mediterranean diet is often recommended, and trying to maintain your weight. So a healthy weight through diet and exercise to reduce the risk of cancer recurrence in some cancers as mentioned, but also to help with reducing the risk of any other chronic disease. Again, another lifestyle modification, smoking cessation. So the advice is to stop smoking to any of the general population, or reduce your smoking habit if you can, but also for patients who are diagnosed to quit tobacco. Quitting tobacco is crucial for reducing that risk of various cancers as mentioned in this slide. It actually will help enhance survival and reduce recurrence risk in many cancers for the generalised population. There's lots of supportive mechanisms out there like Quitline, patches, the inhalers, Champix tablets, the gums, My Quit Buddy, Quitline as mentioned. So anyone who's coming for an education session, if they're a smoker, we should be talking to them about smoking cessation and what can we implement to help them. So it's about asking them about their tobacco. What do? Do they smoke? Do they vape? Do they use a pipe? Do they roll their own? Advise them on the benefits of stopping, and then do we need to implement something to help, an intervention? So then assessing them to see if they're ready to quit, and assisting them with the quitting, and arranging for follow-up to make sure that what we're implementing is effective. So lifestyle modifications continued, so limiting that alcohol. So World Health Organization and any other cancer organization, there is no safe alcohol consumption amount. So basically the recommendation is that the general population 10 standard drinks per week with no more than 4 on a day, and at least 2 alcohol-free days per week. People who drink alcohol are at 6 times more likely to develop a mouth cancer, and there should be those alcohol-free days, and the risk of the cancers are there. So reducing that alcohol consumption lowers the risk of various cancers, as mentioned. So it's just about that education again, because alcohol can contribute to weight gain because it's got a high kilojoule content. Reducing your alcohol can help you sleep better because it disrupts sleep patterns, so it helps that quality of sleep. And having breaks from alcohol can improve your health, including your liver, your heart, your weight, as mentioned, and actually reducing your content can help improve your outcomes, how you tolerate treatment as well, like smoking and any other symptoms that you may get from treatment. So these are just some of the things that we do. So, and if you and what a standard drink is, if your patients are saying to you, oh, I have a schooner. So what is that? Is that light beer? Is it mid-strength? Is it full strength? This is what it actually accumulates to in their mils, but what one standard drink looks like. So if it's a fortified wine, or if it's a normal wine or a sparkling, what your premix looks like, or your ciders, or your alcoholic ginger beers and such, and what your spirits look like. So it's just to give you an idea of what one standard drink looks like. So another lifestyle modification is, especially here in Australia, so your slip, slop, slap, sleek and slide. So how to educate patients on being sun smart and protecting themselves. So we want to avoid that excessive sun exposure, using sun protection to reduce the risk of skin cancer, and educating patients on checking the UV. So not just checking the weather forecast, but actually checking the UV, and to wear clothing that covers as much of the skin as possible in the high UV days or times of the day. Apply broad spectrum water resistant sunscreen, at least 50 SPF, and reapply every 2 hours. A lot of people don't know that. Wear a broad brim hat to cover especially the tips of the ears and the head and the back of the neck. Find shade when you can, especially during those peak UV hours, and wear wraparound sunglasses to protect your eyes as well, to reduce your risk of UV, also the eye melanoma. We also know that healthy lifestyle modifications, including stress management, so educating patients on understanding cancer-related stress, how to identify it and highlight it early so that we can address and implement what we can to help them. Is that a referral to our PsychOnc team? Do they need to phone the Cancer Council and speak to a counsellor immediately? Do they need to get a health management plan from their GP to get an external support for counselling from a psychologist with access to up to 10 free sessions? Do we need to re-educate on healthy lifestyle choices, as mentioned? Coping mechanisms, so promoting that relaxation and wellness, mindfulness, meditation, deep breathing, yoga, diet and exercise, physical activity, adequate sleep, avoiding the smoking and alcohol again. And what coping mechanisms can we help them implement to support them, but also do they need to actually speak to someone else who is more educated in this area, like PsychOnc as mentioned, or psychologists through the GP. But just trying to promote open communication and discussion to get that really good rapport with your patients so that you understand what's going on with them and how are they going to integrate stress management into their daily practice. And actually we really want to be proactive in our approach so that we're implementing these things early, so that patients have really good coping mechanisms and can adapt and adopt what they need to that suits them. Again, lifestyle modifications is just to make sure that a lot of our patients are still working. So if they're in construction, manufacturing, public safety, mining, agriculture, welders, that they apply their PPE. So it's not just for healthcare, it's for other areas as well. So people who work in demolition, renovation, may get exposure to asbestos, so which can cause mesothelioma and lung cancer. So PPE, they have to have respirators and gloves. If they're in rubber manufacturing, they are exposed to benzene chemicals, or there's industrial solvents which has cadmium, there's nickel and steel, there's gasoline with benzene again. So it's just to make sure that they're wearing their PPE to cover their face mask so they don't breathe it in, gloves, protective clothing, is to prevent that inhalation, skin absorption and any exposure. You've also got the police, firefighters and defence, so they can be outdoors in those peak UV hours to make sure that they've got the hats, sunglasses, sunscreen, and they're protected that way. People that work in the mines can be exposed to dust or silica, so we know that silicosis is on the rise, so it's to make sure that they have their respiratory protection. Our agricultural people as well, they're exposed to pesticides and herbicides, so they need to be wearing their PPE when handling it or using it. That includes masks as well as gloves and normally overalls. And welders who've got fumes and chemicals as well, so we want to make sure that they've got their respirators on, their masks as well. We also need to make sure that we're aware of screening for early detection to help with health promotion. So we do have a very good breast screening in Australia. We have cervical screening, we have bowel screening, and we also have from the 1st of July lung cancer screening for eligible Australians. So, and we should also promote those yearly skin checks for patients as well to make sure, and if they're not doing it, patients of screening age, that we try and promote to them that these screening programs are available. They can sign up to them and they can participate, and we recommend that. So really, screening and early detection is studies have shown that early detection can increase survival rates around 90% in bowel cancer. So it's individual for each cancer, but up to 90% of early detection improves survival in a bowel cancer. So we know that it's effective. It can actually help us, early detection can help us with treatment options, because normally the cancer is less aggressive. So surgeries are minimally invasive compared to whether they're at an advanced stage. We know that in the initial stages, with a really prompt intervention, that it prevents disease from spreading, so that reduced disease progression. We can hopefully give patients an enhanced quality of life if we detect early, because they can live longer with better quality, and treatments can be done earlier with better outcomes and more effective. That early detection helps the healthcare dollar, so that reduced cost. Patients who are treated early, who have that hopeful risk of cure, will hopefully not have metastatic disease, not having multiple interventions or extensive treatments. We're hoping to prevent cancers, so again, reduce that healthcare dollar, reduce effect on patients, better outcomes, better survivals. So we know that breast cancer screening, if we catch patients earlier with their mammogram or their ultrasound, then it's easier to treat with a lower rate of breast cancer related deaths. Again, with cervical cancer, we're reducing the incidence with at-home pap reviews. We do have for the home pap smears now as well, a lot more easier for patients to self-test if they feel comfortable, just to make sure that we actually catch those pre-cancerous changes earlier so that we can intervene. And normally surgery is enough, or colposcopy, without having to go forward for any other treatment. And as mentioned earlier, catching bowel cancer early can have up to a 90% successfully treated with early detection without any further metastatic disease. Skin cancer, again, reducing that risk of skin cancers and melanomas, helping again to improve outcomes for patients. So vaccination and prevention, we know that in the community we do have HPPV vaccines that are there for being used, hepatitis, We want to do sun protection, appropriate PPE, and to maintain a healthy lifestyle such as weight maintenance, non-smoking and reduced alcohol to reduce any risk of cancer. So reducing the cancer incidence will improve by improving early detection, enhancing quality of life and addressing our health disparities, hopefully. So in addition to improve quality of life and functional status, as in catching or identifying cancers early with better outcomes and that reduce metastatic disease, reducing mortality rates in cancers, enhancing emotional health and patient empowerment, and managing the complex needs of cancer patients with multiple comorbidities. So basically, we want to be educating patients on recognising and acting early on signs and symptoms of cancer to improve that early detection and give them better outcomes. Health promotion, as mentioned, is vital. It's an ongoing component of cancer nursing care, but it's actually an ongoing component of general population care. Knowing what's out there and available to patients is absolutely critical and crucial, so patients implement cancer screening programs as required. So we have to, as nurses, and not just us here within cancer care, but in the generalised primary health care, we actually play a central role in empowering patients to not only adopt that healthier lifestyle, but to manage their health proactively, implement within screening programs and any preventative programs, and health promotion and prevention as well. That health promotion, as we know, improves survivorship and overall well-being. It's a collaborative, multidisciplinary team approach to health, tailor health promotion plans for patients. So we as nurses provide clear evidence-based verbal and written information, which is really good for patients. It's on their level. We can actually identify any needs that they may have, also for our First Nations peoples, but also for our culturally and linguistically diverse, and again for our elderly population. And we as nurses engage family and caregivers in education and support, and that is vital. As I said previously, knowing what's available for them, what they can actually access and implement, actually helps patients. You'll find that a lot of patients, once you tell them that there's something that they can do to help themselves, they'll be on it to try and help us. And again, that works. That really helps that circle of care, because them being empowered to look after themselves, knowing that it helps us look after them, makes them really engaged. They really want to do it then to actually help and improve their outcomes. So health promotion is crucial for going forward.